Welcome to the Crazy Cool Family Podcast with Don and Suzanne Manning. Parents, what if we could give you the power to transform your family into something absolutely amazing?
A family where everyone is healthy, gets along, loves Jesus, and has great purpose in life.
Hey, let us flip your thinking to unlock the power God has given you to create your own Crazy Cool family. Welcome, Crazy Cool Family Podcast. Don here with my good friend, Jeff Street. Hi, Jeff. Come on in.
Hey, Don. Thanks for having me, man. Excited to be here with you.
We are going to do something fun today that, well, I don't know. Is health insurance really fun? But it's going to be unusual. How about that? We usually are talking about kids and parents and relationship issues. And this will be actually our first financial-oriented podcast. We're going to talk about health insurance today. And Jeff is a dear friend of mine, and he's also he's been telling me and I've known about this product for years, health sharing. And so, first of all, Jeff, before we get into health sharing, I just want to introduce the podcast first, what we're going to talk about, and then introduce yourself a little bit.
Yeah. Well, Don, again, thank you so much for inviting me to be a part of this. It's really an honor to be on here and talking to the Crazy Cool Families community, and just have so much respect for what you guys are doing and just adding value to families. You know, obviously the family dynamic is one of the biggest things that we all need to focus on, especially in these times. And, you do such an amazing job just helping people and helping the family unit. So I just moved to Highland Village, Texas, actually from Connecticut a little over 2 years ago. And my first weekend here in Texas, actually was unpacking our suitcases and said to my wife, or my wife said to me, she said, "Honey, it's Sunday and we're in Texas. I think we could probably go to a live church." And with the pandemic, we hadn't been to a live church in so long. And I said, "Well, honey, it's 10:45. Like, you think there's anywhere we can still go?" She's like, "Oh, I found a church. It's 7 minutes from here." I go, "Let's go." So we ended up going to Valley Creek Church that day and walked in. There was a baptism. It was just a big, big day in our lives, and never left there, and was blessed to meet some amazing people and create some amazing relationships like yourself, Don, from being at Valley Creek. But I've been self-employed. I'm 44 years old. I've been self-employed since I was 19 years old, owned multiple retail stores in the past, and for the last 18 years, actually been in the direct selling industry.
Oh, wow. And out of your business, that's what that story is you kind of got into, you saw the health sharing model, so much so that you decided that you become an advocate and a direct seller of it, right?
Yeah, we've been my wife and I we're in business together, so it's been a family business for us. My wife was a former insurance agent, actually, for State Farm Insurance. So, like a good neighbor, my wife was always there, right? So she had some good insights to the industry. But we've been selling different services to individuals and families and small businesses for years, looking for solutions to help people, help businesses save money, and find services that maybe they need that they don't have yet. And about a year and a half ago, partners of ours came to us and said, we've got a different service that we think that you could market, and we want to get your feedback for it. And it's called healthcare sharing. And I said, well, I've heard of Medishare, I've heard of Christian Health Ministry, never really knew a whole lot about it, but I heard of it. So let me kind of check this out. And my wife and I were fairly healthy people. We always carried a high deductible health insurance plan because we didn't really go to the doctors much at all. But we were paying just under $1,000 a month for the two of us on a really high deductible plan. So I went and I got myself a quote with this particular healthcare sharing company, and I was blown away, Don. My plan came back at $364 a month. The PRA, which is like a deductible, was cut more than in half. They said there was no network. I could go to any doctor I wanted. And I was excited, but at the same time, like really cautiously optimistic, thinking, well, this is great, but what's the catch? And I really just started doing a lot of due diligence. Actually, I spent a lot of time with the CEO of this particular company, got to know him, really started learning a lot about the industry, and went from being cautiously optimistic to just being really, really passionate about this concept. And today, when people are like, well, what do you do? I say, well, I'm on a crusade to disrupt what I really believe is a very, very broken healthcare system in our country right now. So yeah, I went from cautiously cautiously optimistic to now this basically being pretty much my full-time business at this point.
Well, and so what we love to do at Crazy Cool Family is educate. Yeah. And so, one of the things we do is we educate people on the power of relationships in your home. We educate you on, how to do culture and how to build your family. Well, so that's what we want to do today is with Jeff. Jeff and I have had conversations and about what health sharing is versus a traditional health model. A lot of you have benefits with your companies. And so sometimes this product will make sense and sometimes it won't. But today, really, I just felt like, in talking to Jeff and talking and seeing where the market's going as well, that it would be worthwhile to have a conversation with our friends here with Jeff and with his company about what health sharing does and how we can, who it benefits and why and what to look at. So first of all, maybe we just start out with a comparison of health sharing versus traditional healthcare plans, kind of, positives and negatives of each.
Yeah, no, I'd be happy to do so. And like you said, healthcare sharing, it's not going to be a solution for everybody. Our target market really encompasses about 91 million Americans that we believe that this can really be an amazing fit for. And
who are those 90 million? Who are they?
Yeah, so healthcare sharing is really designed for people that are healthy or fairly healthy. Individuals that, to your point a minute ago, either are responsible to pay their own health insurance or pay a portion of their health insurance. Definitely individuals that are self-employed, folks that are 1099, small business owners, businesses with 49 employees and less, gig economy workers. There's a lot of folks right now doing the Uber, doing the Airbnb, doing that gig economy, DoorDash, Uber Eats, you name it. A lot of them don't have health insurance. So there's the real estate professionals. That's another big thing. I heard a stat not too long ago that over 36% of real estate agents in our country have no health insurance. And I don't believe it's because people want to play Russian roulette with their life. It's just the cost is really high for folks that are self-employed. And the amount of people that are underinsured or have no insurance at all right now is really, really risen at a staggering rate. So folks that fall into those categories, that's really our target market. For people that have a serious health condition, healthcare sharing might not be the right fit for them. Healthcare sharing, think almost like a privatized, private healthcare club for individuals that are healthy or fairly healthy.
Right.
And what I mean by that is individuals that have what's called a pre-existing condition, where over the last 36 months there's been signs, symptoms, treatments, or diagnosis. Those particular ailments are not what's called shareable in a healthcare sharing community until they've been sign, symptom, treatment, diagnosis free for 36 months. Now, there's a couple exceptions to that. If somebody's over 65, healthcare sharing does offer a replacement for somebody's supplemental plan for Medicare if they have Medicare A and B. So for seniors over the age of 65, pre-existing conditions doesn't matter. They can be going through anything and they can still be a healthcare sharing member and not have to worry about what's covered, what isn't when it comes to pre-existing conditions. And then also for those younger than 65, if they have any form of high blood pressure or high cholesterol, as long as it's controlled, that's not counted against them for any future cardiac or vascular event. But for people that are really going through something significant that are under 65, traditional health insurance is probably going to be a better fit for them. Healthcare sharing basically rewards folks that have a healthy or fairly healthy lifestyle with typically a rate with a rate that's typically 30 to 70% less than traditional insurance for the average individual, for the average family.
Now, so this would also impact someone who's maybe with a company that does provide health insurance, but really they have to pay a lot of it, because they maybe the company makes them pay, hundreds of dollars a month in terms of their portion of the health insurance, right?
Yeah, no, you're absolutely right. And somebody can easily get a quote with a company like the one that I work with, and they can go to their HR department and say, hey, if I opted out of the company's healthcare plan, what would that look like for me? And believe it or not, because health insurance costs are so high for employers, I heard a statistic the other day. I think the average about $700 per employee cost as the average cost for employers to offer health insurance to their employees. So sometimes companies will actually give somebody like additional financial rewards to opt out of healthcare. Hey, we'll give you an extra $300 a month or $500 a month if you opt out. Not all companies do that. Some just say, hey, you can opt out if you want to. But somebody should definitely look at talking to their HR department if they see that a healthcare sharing plan can be a big benefit for them. Also, there's no open enrollment period with healthcare sharing. So somebody can become a member at any time and their coverage actually begins the first day of the next calendar month. So unlike traditional insurance, people don't have to wait for open enrollment to look at a new plan to see what type of benefits there could be for themselves. And also when they talk to their HR department, sometimes they'll even say, wow, like why are you opting out? Well, here's what I'm looking at, healthcare sharing. This is something that works for businesses as well, especially those that are 49 and less. So sometimes the business owner actually wants to offer it to their employees.
Yeah. So a lot of technical terms thrown around as you were talking about vascular and all kinds of things. And so I want to kind of break it down just a little bit more, maybe even summarize a little bit. So, like if you have, so one of the things that you were saying, Jeff, is that if you have a pre-existing condition and you go from employer to employer, let's say, in a more of a traditional job, traditional healthcare, you're not going to have the pre-existing condition is going to be accepted by the new employer or is going to be taken on, most of the time. And so that therefore, with traditional health insurance, there is a, that pre-existing condition. But if you are in a health sharing type situation, and let's say that a condition starts, let's say that you have cancer or something, then that doesn't become a pre-existing condition in your new health share. They will continue to cover that. Even if you have remission and come back or whatever, it's only when you start, you have to have, that's where the pre-existing condition can be disallowed. And then you would get everything else covered except for that, right?
Yeah, you're absolutely right. So if somebody has something, let's say I broke my arm, last year, and I'm not in healthcare sharing. Well, I enter a healthcare sharing community. My arm, is technically a pre-existing condition until I'm sign symptom treatment free for 3 years. That's probably not going to discourage me from being a healthcare sharing member because I don't have a lot of concern that that's going to happen again to me over the next 2 years. But if I've been cancer free for 6 months, then I'm probably not going to want to go to a healthcare sharing company because you just never know if it could come back quickly. But to your point, once somebody's in the community, as long as they were healthy when they entered the community, God forbid, a year from now or 6 months from now or whatever, somebody has to have an organ transplant. Somebody gets in a major car accident. Somebody has cancer. There's, in most healthcare sharing organizations, ours being one of them, there's no lifetime maximum. So it's not like your auto insurance company, you get in a bunch of car accidents, they kick you out. Here, if you become unhealthy after being part of the community, there's never going to be a lifetime maximum where they would remove you from the plan.
Is there any that's another thing that people ask me a lot about healthcare sharing versus, and even with traditional healthcare policies, there is a maximum sometimes, and, usually that maximum is millions of dollars. But with healthcare sharing, is there an annual or sometime maximum on any kind of healthcare that they provide? Or any...
Yeah, there is, and there is with traditional insurance as well. And most people don't ever really look at their health insurance policy and know that there is a maximum. So yes, with healthcare sharing, there is an annual maximum per member. Many of them are $500,000 a year or $1 million a year, and those amounts are actually what's called repriced amounts. So, for example, the company that I represent, we have a reference-based repricing model where we advocate for our members. And I'm going to try to talk in like some simple terms.
Right.
So what that means is somebody gets a bill, right? It gets sent from the provider, the doctor's office, to the healthcare sharing organization. The healthcare sharing organization, for example, like the company that we represent, they'll now advocate for their member and make sure that bill is fair market value. So our average...
Which means they're going to reduce the bill,
Yeah,
basically.
so on average, we reduce the bill. It's crazy, like what people are getting billed. On average, we reprice the bill by 72%. I'll give you a real-life example. We have a roofing company that's a customer of ours. They had an employee just last month, broke their leg. They had a $200,000 medical bill. $200,000. That got sent to our healthcare sharing company. They negotiated the bill down to $20,000.
Oh, wow.
Now, what the member was responsible for was their primary responsibility amount, which is like a deductible $5,000. So from a $200,000 bill, the member paid just over $5,000. And so, again, that annual maximum of let's say $500,000 or $1 million a year, that's the repriced amount, not the actual bill. So somebody would have to have millions and millions and millions of dollars of medical bills for a year to actually ever hit that maximum. And many organizations like ours, we have a separate nonprofit entity, almost like a slush fund, where members can contribute an extra few dollars a month. We even have like a seasoning actually that we sell, where 100% of the proceeds goes towards this. And what that fund is for is, let's say, for example, somebody entered the community, they had some sort of a pre-existing condition, but they just didn't really understand it, or maybe they went over a maximum, which actually has never happened since our company's inception. Nobody's ever hit that maximum. But as a just in case, we have that extra fund that's there that a member could actually apply for, and actually we had a real life story of somebody actually in Iowa 2 months ago where they had a pre-existing condition. They didn't really understand that they had it. So it came back that their bill was not covered, and they just didn't understand it. So they were able to apply for our program. It's called Impact Extras. And our company literally sent a check for a little over $50,000 to the doctor's office on that member's behalf on something that technically was a non-eligible medical expense. It's a really amazing community that we've put together. Other organizations do something similar just to cover those people in that what if scenario. You can't take advantage of it. Like, it can't be blatantly, obvious, but I love the fact that things like that are available for members.
Well, let's transition to kind of what some people have, if you've talked to people that have seen this health so you've got people who maybe don't know anything about health sharing, or you have people who have heard about health sharing in the past. And a lot of people that have heard about health sharing in the past, heard about it, we were just talking about this pre-podcast, is that, at first this was really religious-based, industry, and a little bit what I would say kind of behind the times technologically. Are those both fair to say? So take us on a little history of where the industry was, where some people may have, you talk to people all the time about this in your crusade, right?
Yeah.
And so you hear a lot about the past of health sharing versus the present, and kind of take us on that journey a little bit.
Yeah, no, you're absolutely right. And healthcare sharing,
and kind of how the claims work, and do work and things like that.
No, definitely. No, I'll dive into it. But I really, to your point, really want to help people have a really good understanding of what I mean by healthcare sharing. And it's not a new concept at all. To your point, it's been around for over 40 years. Right. We were talking about Dave Ramsey earlier, and Dave's been a big advocate of healthcare sharing for many years. And healthcare sharing really started out in the church, where basically members could, and it was a real exclusive thing where you actually had to have an affidavit from your pastor originally to be able to become part of these healthcare sharing communities. And it was like a healthcare sharing ministry where a church could have their own, a separate nonprofit account where members would each pay a few $100s a month into this bank account. And the only thing that the account could be used for would be to pay members' medical bills. So it's really like a community approach. It started out in the Christian church, and then it really became popular in the Amish and Mennonite community and started to grow from there. But it was really, there was, now healthcare sharing is really technology driven. We call it decentralized healthcare. So it's almost like the Uber or the Airbnb of health insurance, where we're really industry disruptors, so to speak. but it was much more of a cumbersome process back in the day.
Kind of like the Bitcoin of.
Absolutely. But just, to give people a little bit more of an understanding of why it's so important right now, health insurance is really at a tipping point. The average American family in 2019 spent $1,750 some a month on health insurance. The average individual spent $452 a month. 80% over almost 60% of all bankruptcies in 2021 were due to people's medical bills. They say 80% of the country is trying to cut down their healthcare costs. And the reason why healthcare sharing works so well in a time of stage where there's over 100 million Americans that are in some form of healthcare debt, the reason why healthcare sharing works so well is 5% of the population equates to over 50% of all healthcare costs in our country. Mm-hmm. And it was really when I understood that I understood like why I was able to pay so much less with the healthcare sharing organization, because most people are healthy or fairly healthy and just paying a ton of money to be able to subsidize the cost for people that aren't healthy. So remember, like that private healthcare club I was talking about, really for people that are healthy or fairly healthy, there's so much less of a risk factor for a healthcare sharing company. That's why the prices can be so low. But originally, it was all religious based. And so recently, over the last couple of years, healthcare sharing has gone from just religious-based entities to now there's organizations like ours that are ethics-based instead of religious-based. Mm-hmm. So what that means is we have that love thy neighbor approach. We accept all creeds, all walks of life, all religions. We have a lot of Christian brother and sisters that are members of the community, just like myself and my wife, but we have Jewish members, we have, Hindu members, we have Buddhist members. And I love that fact because Jesus wasn't spending his time just talking to people that were already believers, right? And so I love that love thy neighbor approach that we can reach out and engage with, so many different types of folks. Also, it creates opportunity now for small business, because small business, it was hard for them to offer healthcare sharing to employees, saying, hey, here's this great cost, alternative, this nonprofit alternative to insurance approach, but you have to be of our faith to be part of the healthcare plan. So that was always a real sticky thing, a hard thing for business owners that wanted to offer an alternative to traditional insurance. But previously, to your point, Don, in healthcare sharing, most healthcare sharing members, actually all of them, when they went to the doctor, they would have to pay as a cash paying member. And then they would have to submit their receipts to some of our good brother and sister healthcare sharing organizations. That then it was kind of a cumbersome process. And then maybe 60, 90 days later, they'd get reimbursed with a bunch of checks from from different people in the community. So it's a peer-to-peer community approach. And it was great. It worked really well, but it was cumbersome. And somebody had to have the money to be able to pay up front. Now, the price that people paid a month was such a great advantage that still it was a great thing for people. Mm-hmm. But for some people, it made them maybe not be able to do it just in case they had to pay as a cash paying member up front. Some people couldn't afford that. So now with technology, organizations like the one that my wife and I represent, we have the ability now that when a member goes to the doctor's office, the doctor just inputs what's called the payer ID number. It's on the back of the healthcare card into their billing system, and they bill our company electronically, which means the member doesn't have to pay up front. Just like insurance, it gets sent to the healthcare company that then pays the provider. So they've really architected it now to really look and feel just like insurance, but with a 30 to 70% average discount for the average family saves $9,000 a year with healthcare sharing. Mm-hmm. And I know obviously this is all about family, and $9,000 a year back into the budget of an average family can do so much for that family unit.
So what I'm hearing is, again, kind of in summary, that because of technology and because it's no longer a religious-based deal, but a ethics-based deal is what you said, I think, is that it was the term that now anyone can do it. Companies can do it. Like many companies, it's very difficult to offer health care for the employees because it costs $2,000 a month for a family. And it's just, the wages are just, it's really tough. And so this is a way that they can offer that to their employees, or people can choose it themselves. And so, and what you're saying is the bill process, it used to be that, literally just think about that, in 10, 20 years ago, you paid everything up front, and you got a bunch of checks in, you had to keep track of all the bills. And it's just was very different than the traditional healthcare model where you went and paid a copay, and then you did that. And if you had a surgery, you paid a lot more because that went into your deductible and everything else. But the process, even though the healthcare process, the traditional healthcare process could be very cumbersome, it was very different in the health sharing industry. What I'm hearing you say is that even though both are still healthcare and still, have their issues, the process of health sharing has become much more manageable for the person that's going through the medical problem.
Yeah, no, absolutely. And I know I told you I wanted to just be really transparent and, talk about the positives. There's a lot of them, and also talk about, any challenges that can occur. And so we talked about the pre-existing condition, piece to what we just talked about. The technology has advanced so much, but there still isn't 100% buy-in from providers. So, for example, somebody goes to the doctors, they give their healthcare sharing card, and sometimes there's going to be what's called provider pushback, where they say, well, I don't know what this is. I've never heard of this. So organizations like ours have really put processes in place where there's a provider support line, so our members can actually fill out a request prior to even going to the doctor's office, where they can call on the member's behalf ahead of time, just to educate the provider. Hey, here's who we are. Here's what we do. Here's what percentage we pay. We're really proud that we have the fastest pay time in the industry. So we're processing and paying bills from providers in under 30 days time. So for providers, they're actually getting paid a lot faster than they do from the insurance companies with less hassle. And they actually are getting paid a little bit more as well. So just if somebody doesn't do the process of having that provider outreach, they're going to be more likely to maybe walk in. Again, there's no network. Somebody can go anywhere, but they might walk in and have the private provider say, well, we've never heard of this. Now, even when we do things the right way, and they send in that form and we do the provider outreach, there's still going to be some times where the provider just says, hey, you know what? There was a healthcare sharing company years ago. It took them a long time to pay us. We don't know if we want to take this, or we just don't want to take anybody new at all. In a situation like that, if that member still wants to go to that particular institution or provider,
which they can choose anybody.
Yeah, they can choose anybody. If the provider doesn't want to take them, they can still go there if they want to. They can get their treatment, and then they can be treated basically like one of the previous generation of healthcare sharing members. They can pay as a cash pay discount and just submit it to companies like ours for reimbursement, and we pay the member back as quickly as we would pay the provider. As long as they've hit their PRA, which is like a deductible, we'll reimburse them. If they haven't, then it'll just go against their PRA or deductible. So, that is something where, as long as people are educated and know going into it, they're not going to have like a negative experience. But if they don't know that going into it, if they walk in somewhere, hey, I'm excited, I got my new healthcare card, and the provider said we don't take that, obviously that could be a bad experience for somebody.
Well, and so you referred back to the pre-existing condition, and some people have, with the health sharing option, so we know that it's a very viable option for somebody who doesn't have a pre-existing condition and also might not have insurance, have access to health insurance. So super good alternative there. And it's also come a long way. Compared to the person who has a traditional health plan with an employer, they usually have a copay for a lot of their stuff and things like that. Do you have the same kind of copay, or do you just first meet that deductible and then pay a percentage after that with the health sharing?
Yeah, great question. And when we do a little bit of a comparison, so in health insurance is a high, typically a high premium. One thing that's a real big deal right now is that there was an article in Wall Street Journal last week saying that during open enrollment this year, which is the period of time, it's in the fall when people choose their health insurance company or employers choose who they're going to go with for their employees for health insurance. This year, they're expecting a 6.5% premium increase, which is going to be the highest increase in over 10 years. Now, contrary to that, like healthcare sharing companies like ours, we've never had a price increase. We're saving individuals, families, small businesses 30 to 70%. In health insurance, a lot of times there is a deductible per family member. In most healthcare sharing organizations like ours, it's actually one combined family deductible for the entire family. For us, it's actually it's as low as $2,500 a year for the whole family. Also, typically people are tied to a network. In many healthcare sharing companies like ours, there's no network. But also we have some of the best prescription pricing in the industry. That's a big benefit for members. If people have heard of GoodRx Gold, they can actually, through a good healthcare sharing company, get great prescription and drug discounts cheaper than GoodRx Gold over 90% of the time. The co-pays that you talked about, mainly they're called a provider fee with health sharing, and a lot of the times we're significantly lower than what they used to pay as a co-pay. So, for example, our members get a free annual wellness visit or physical and $150 blood work credit. But my ER and inpatient fee with my previous provider, Blue Cross Blue Shield, was $600 if I went to the emergency room. With our healthcare sharing organization, it's $150. So that's like a copay. We call it a provider fee. An office visit would be $50. We also, in many healthcare sharing companies, share in mental health, which is so important, especially in the family dynamic. A lot of times that's not covered with insurance. And even outpatient therapy as well, like physical therapy, chiropractic. So good healthcare sharing organizations, and unfortunately there's been some bad apples in the past that didn't do this in a transparent and integrity filled way. But there's so many good companies out there that do what we do. They want their members to stay healthy, so they're really looking at like holistic wellness and different options like that, not just to have somebody get healthy, but to keep their members healthy. But we do 24/7 free telemedicine, which is really awesome as well. I used to have to pay for that. So no, there's some really significant benefits again for those people that are in the healthy and fairly healthy, not just the price. But I believe for many people, the coverage is actually better. Again, those that fall into that right bucket, that healthy and fairly healthy, where it's not just less, but actually people can get access to more care than they previously could.
Well, Jeff, first of all, thanks it's been very educational. And if you're like me and most people that, maybe our head's spinning a little bit with all the terms and everything, but that's why I like to always bring it into something simple like you've done, to just say, man, it is, check it out and just check out the benefits, do the research. It's the industry's come a long way. Our health insurance industry is going downhill in so many ways. Yeah. And it's also just, it's some of it's the health insurance companies, but also it's just our aging population, yeah. More and more people, more and more cost and more ability to do things, which there's a whole discussion that can be had about, health insurance in general and why things are happening. But because of all that, that's why I wanted to bring Jeff on, because I just believe this is a good alternative for some people to check out. And the industry's evolved. I've been a business owner. I've been in the business world a lot. I see things and I know how and I've, obviously run our family for over 30 years. And so it's something that it should definitely be considered by every family, especially those that don't have health insurance or have very poor access to health insurance. So, Jeff, how can they get a hold of you?
Here's my personal cell phone number, and anybody can feel free to call me or text message me, but it's area code 267-974-1059. So again, that's 267-974-1059. I know, Don, that you're also going to put our email address for my wife and I in the comments as well. And I tell people 5 minutes could actually help save somebody 50% or more on their healthcare costs. So really simple. If anybody's like, hey, I'd like to know what a quote would look like for our family, it's a super simple process within minutes. we can let people know what that would look like. And even if people just have questions like, hey, help me understand a little bit more about healthcare sharing, or is this something that could be the right fit for me? We just love to be a resource in any way that I can to your community. And just one thing that I just was thinking about a minute ago, my wife is, I think, what women always find ways to just make it maybe more simpler than we do with so many things in life. And my wife usually gives this example, and I think it really helps people understand what healthcare sharing really is all about. Let's say that you go to the doctors and you get a bill, it's $20,000, and you're not sure how you're going to pay that. Then all of a sudden somebody taps you on the shoulder and says, here's $150. Then somebody else taps you on the shoulder, here's $150. Somebody else, here's another 100. So it's really just a community approach, members of the community sharing in each other's medical bills and helping others. So hopefully my wife's example makes it even clearer than some of my examples for your listeners.
Well, it has been very clear in so many ways that it's just, it's a complicated, healthcare in general is a complicated process, but it really does come down to just, saving money and looking at alternatives. And so, again, thanks for being here. We will put that in the show notes, a way to contact. Just, call Jeff or email him and say, hey, heard about you on the Crazy Cool Family podcast. What I do know is that Jeff and is a very reputable person. I know that he's going to take care of you. There's certain, I've always seen Jeff get back with me, just all the things that are good. So if as far as a trusted confidant and give you advice, I've also seen Jeff really tell people, like he did on the podcast today, the good and bad, not try to, necessarily sell you on a particular approach just because that's his, but really just try to get the best for the person. And so that's really, that's a credit to you, Jeff, and the way you do things. So, and so again, health sharing, we'll put the cell phone number and an email address in the notes if you want to have further info about it. And I hope that it's something that blesses you guys, and hopefully it's something that'll provide insurance for somebody that might not have it, and or save money for people in the process. So, Jeff, thanks for being on.
Thank you so much, Don. God bless everybody.
Yeah, and as always, parents, go be crazy. CrazyCoolFamily.com.